Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Hi folks, I'm Alex, physical therapist assistant,
I'm Mike, physical therapist assistant.
and this is the Total Hip Replacement Fitness Program. Exercises before surgery, also known as
Pre-op.
pre-op exercises. Some tips before we get into the exercises. Number one, start your pre-op program at least 6 weeks prior to surgery. You know, it takes some time for your muscles to strengthen, you know, flexibility to happen. So 6 weeks prior to surgery at least before, you know, if you can do it before that, that's going to be even better.
Yes. Tip number 2, if you are new to exercising, start slow. You don't want to injure anything. You already have a sore hip, so just take it slow. Do some of these exercises. Do which ones work for you and that are pain-free. If any of them increase your pain, do not do those. You may not have to do all the exercises. Just choose which ones suit your needs.
Patients always say, no pain, no gain to us, and that's absolutely not true in most situations.
That's
So,
not true in rehab situations whatsoever.
yep. 3, if you're an exercise buff, I mean, you're big into exercises, this is where you're going to increase your intensity, your duration, and your frequency or your routine, like you're preparing for a race. Now, you know, the points in number 2 still apply, pain-free, avoid injury. You know, I'm not saying get out there and go wild, but, you know,
if some
bump
of
it
these
up.
seem really easy to you and you don't need to do them, don't do those. Do the more challenging ones if you're used to
Right.
exercising. So this program can work for beginners or more advanced.
Yep, that's right.
Next, you can continue doing any activities you're doing. We don't know you personally. Like if you're doing yoga, it doesn't hurt. Go ahead, do yoga. If
Yep.
you want to do aquatic therapy in a warm pool, go ahead.
Aquatic therapy, great for really painful joints. So.
Yep, just takes a lot of pressure off it. If you like walking or hiking, go ahead. Maybe
Yep.
use a walking stick if you need it to take some pressure off. Also, diet can play a big role. You know, do your own research on diet. We're not nutritionists.
Yep.
So,
Yep. You know you, so.
Yep.
And the medical studies out of Boston, pre-surgery participants reduce their chance of needing inpatient rehab by 73% with the appropriate pre-op exercise and conditioning program. So,
yep, typically the little stronger you are before your surgery, the quicker you'll recover.
yep. And less hospital time means more home time, and that means better quality sleep and recovery at home versus a hospital.
Yep, and some people don't necessarily stay in a hospital. They might go to like a skilled nursing facility too.
Right.
Not everyone does after hip replacement. Don't feel bad if you have to, but if you have the chance to go home, you know, you're probably going to rest a little easier there.
All right, now on to the exercises. We have 9 exercises for you today. We're going to start very easy. I'm going to be doing a lot of these in the seated position, and Mike's going to do laying down. So, number 1, ankle pumps.
So just bring your ankles up and down. You can do both legs together.
Yep.
It's not going to hurt the uninvolved leg.
Just get the blood circulating.
Yep, Alex
Yep.
is doing them in a seated position.
Yep.
He's actually doing toe raises.
Calf and toe raises. Yep.
Yep.
Okay, are you done with ankle pumps? Or?
Yeah, I'm done.
All right. Number 2, glute sets. This is literally just squeezing your butt cheeks together. I'm doing it right now.
So if I'm doing it, you can kind of see my core engaging a little bit. Hold it 3 to 5 seconds,
Yep.
and then relax. Make sure to breathe the whole time. Do not hold your breath.
I would do about 10 reps of this, and then that's probably enough. 10 every couple hours.
Yep,
Easy
we're
enough
going to
to do.
hit all your leg muscles here, so some are going to be more involved at the hip, some are more the knees and the ankles.
Yep,
A little
correct.
bit of everything.
All right, number 3, these are called quad sets. So
Yep.
Mike will demonstrate here.
So what you're trying to do is push the back of your knee down into the mat. So you're going to activate, push down. Again, hold 3 to 5 seconds.
Yep.
and then relax. If you have knee pain with this, just do what range you can. You don't have to force it down.
Yep.
Or if this hurts your hip at all either, also.
But if you're expecting a hip replacement, I mean, these muscles are probably a little weak. You're going to feel it doing some quad sets. I
Yep.
promise you.
It still works your hamstrings, which connect to your glutes, so
Correct.
it's still going to work.
All right, number 4, we're going to do some heel slides. I'm going to get Mike the knee glide here to make it a little easier for him.
Yep, if you don't have a knee glide at home, you can use a towel or just a sock on the bed. You can do these on the bed. So you're just going to slide in and then slide back down.
Yep.
Well, you didn't put this far enough down for me, mister.
Well, you're sitting way on the edge.
Oh, I am.
All right.
There we go.
And you could even, I'll switch up a little bit. I mean, you could do it seated like I am. I didn't have it on the board, but, I mean, you could even get your knee moving in the seated position.
So these ones just, a few seconds each way. You don't have to hold them like the other exercises. Just go through the range of motion with them.
Yep. All right. Then we're going to use the knee glide again. The number 5, supine hip abduction, a fancy way of saying move your foot out to the side. Kind of get your hip working a little more than your knee.
So with this one, again, boy, I'm really too high up.
Yeah, you are.
Move that down for me.
Please.
Young lad, please.
All right.
All right, so you're going to go out to the side and then back in.
Normally you'd be on a bed. You'd have a little more movement than being on a mat table here.
Yes, I'm just going to hold it down so it doesn't move
Yeah.
all around on me.
Did you say you could use a pillowcase too if you don't have a knee glide?
I said a towel.
A
Or
towel
a
or
pillowcase. Yeah, you're going to have more room on your bed. We have a pretty small plinth. This is definitely smaller than a twin mattress here.
Sure.
So,
And you're not a tall guy, so
hey.
what's that saying about the mat table? All right. Number 6, short arc quads. We're going to get a little strengthening of the quads.
Yeah.
I'll take that.
Well, you put a towel, or you can fold up a pillow under your knee. If you have a foam roller and it's thicker, you can use a foam roller as well. We just have a bunch of towels rolled up here and taped.
Yep.
So all you're going to do is activate your quads. So kick your foot up in the air while
Yep.
keeping your knee on the towels.
And you want your leg as straight as possible. When Mike raises here, the goal is to have your knee as straight as possible.
Yep. Try to have your toes pointed towards the ceiling, too. You don't have to go forward
Yep.
at all. That doesn't matter too much. But
Yep. And go down slowly. It's still
Oh.
strengthening when you're going down, Mike.
Go down slow. Got it.
All right.
How's that one?
That's good. Do about 10 reps. Those, work up to doing 15.
Next one is a straight leg raise. So this is kind of a combination. Works your quads, hamstrings, your hip flexor muscles as well. So you're going to actually start with the quad set. So I'm going to push my knee into the mat.
Yep.
So I'm quad set. I'm good there. You can have the opposite leg bent. So this is the side that's I need surgery on. This side's going to be bent. All I'm going to do is hold this tight,
Quad set,
hold up,
and then raise.
and back down.
Now, he made that look easy. You might just raise it 3 or 4 inches off the ground, and that's plenty.
Yeah, if you can only go here, you're going to feel it right in your hip flexor, your iliacus, and psoas major.
Yeah.
So you can go, if you have good motion, doesn't hurt, you can go parallel with your other leg. You
Yeah.
don't have to go that high. Just do what you're comfortable with.
Yep. And this, if that's too easy, add a cuff weight on your ankle. Make it a little harder
Yep,
for
you
you
can put
buffs.
a little weights on your ankle. You can also hold it up there longer and
Sure.
then go down if you do not feel like getting a cuff weight.
That's right. All right, number 8. This is one for your arms. We had to throw in one for your arms because your arms are going to be doing a lot of work early on. You might be using a walker. I mean, they're going to need to be strong to take weight off your leg as it's probably causing you a little pain. So I don't have armrests on this chair. We couldn't find a chair with armrests down here. But just imagine I'm holding on to armrests, and I'm pushing up with my arms just to here, and then back down. Chair push-ups.
You're in that predicament like he is, just put your hands on the seat,
Sure. Yep.
and you can push from there. It's a little lower,
Yep.
but
Don't stand all the way up. This is more of a tricep workout
yep,
than
so all he's
anything.
doing is pushing,
Yep.
extending your arms. Your legs are helping a little bit, but try to push with your arms.
Yep. Your legs are just there for balance, pretty much. So
And the last one
number
is
9.
the FITGLIDE. This is a product Bob and Brad made. It is basically 2 knee glides put together into one.
Yep. It's a good workout.
But yeah, they're pretty lightweight, easy to move around, portable.
Yep.
You can put them wherever. It's just a good workout. He has it at an incline right now. You can also put them flat if you would like,
Yep.
or even a decline. The different incline or decline are going to hit your quads or your hamstrings more, depending upon which way. So You can do this, you know, a few minutes. You can do 5, 10, 15, depending upon your fitness levels.
This really makes you work when you turn it around here.
Yep, and if they start to get some friction in there, you just can put some lubricating spray in there, and they'll glide right away again. So,
All right. What do you else you need to say?
check out any other videos related to the Total Hip Replacement Fitness Program. You can go to bobandbrad.com/programs to find any other programs that Bob and Brad or Alex and I made.
Check out the programs. Thank you.